giving us some information on our websites, not our websites, our webinars and our different programs and different groups like this one. So I will turn it over to Emily. She's going to give us a lot of information on PKD and diet. Thanks, Emily.
Thanks, Judy. Thanks, Sadia. So my name is Emily. As you all learned, I am a registered dietitian and certified diabetes educator. And I'm really excited to be talking about the topic of nutrition and kidney health, and specifically for individuals with polycystic kidney disease. I think we're living in a wonderful time right now where we're learning a lot more about how nutrition can help with PKD. And so some of the information we'll be talking about is what was published in our recent recommendations just in 2025. So we'll walk through the different steps, but just remember that everyone's diet with PKD is different. We all have maybe other health conditions, we have different blood work values, and so this is kind of general information. It's really important to work with your healthcare team to get personalized information, but I'm hoping that you'll get some tips and tricks here that you can bring back to your team to see if they'd be appropriate for you. Fortunately, this will be recorded and there's some resources available as well afterwards, but really hoping to also have quite a discussion with you. So feel free to put questions in the chat, and then at the end, we will also have a time to go through those or to speak out verbally too. Oh, let's get started here. What we'll be covering today is really understanding the important role nutrition has in managing polycystic kidney disease. We're going to talk about some of the new nutrition considerations for PKD and discuss some practical ways to implement nutrition strategies into our diet. And as we get started, I'd love to kind of just hear from you in the chat. Have you already started making nutrition changes to help manage your PKD? Maybe just give me a thumbs up or a yes in the chat. It's never too early or too late to make nutrition changes. So if you haven't, that's okay, you're in the right place. If you have, then hopefully you'll learn a few more things that you can cover today. Perfect. All right. That's okay. We'll talk about some great things that might be small changes that we can make that will help make a difference. So to get us started, let's talk a little bit about the basics of nutrition for PKD. Nutrition can, of course, help to slow the progression of cyst formation and also preserve our kidney function. And the most common tool that dietitians use to make nutrition changes is a 24-hour urine collection. And 24-hour urine collections, they tell us so much information about how our body is using the foods and how much we are excreting it in our urine. And while collecting that big jug, or sometimes when we have PKD, it's multiple jugs per day because we're drinking a lot of more water, it really does give us a lot of information. And one thing to know when you're doing your 24-hour urine collections, often your nephrologist will recommend you do these. We don't do them very often. It's typically once a year, gives us kind of an information about what happens in that 24-hour period of when you're collecting. So you do want to make sure that the days that you collect and a couple of days before you collect, you make sure that you are following your typical diet. That way, dietitians can help make the most recommendations for you. And the goal of nutrition and some medications for PKD is to really regulate this vasopressin hormone. And when we have too much vasopressin, which occurs when we have PKD, it causes the cyst to grow. And so often this vasopressin hormone is elevated, and nutrition can actually help to lower that. And that's how we prevent cysts from forming. And then also from a nutrition perspective, we want to make sure that we're keeping our heart healthy, we're keeping our bones healthy. And so though we're keeping our overall kidneys healthy, and all of those things kind of come into the goals of nutrition. So today, we're going to be talking about the general nutrition recommendations. And again, it's important that you speak to your healthcare team for really personalized advice. I'm going to be going through some of the literature today, but we won't go too deep into it. So it should be very easy to understand for everyone. And I'm hoping that we'll clarify some of the contraindications you may have seen on Dr. Google or on the internet. Well, let's get started here. So I like to break down nutrition for PKD just using these 5 kind of topics. So of course, water. Often when you have PKD, the first thing you're told is to drink more water. Salt, protein, fat, and fiber. And so we'll break up into each of these sections, and learn a little bit more. From a water perspective, we really want to be aiming for at least 3 liters of fluid per day. This is 12 cups or 96 ounces. And one of the first things that I hear from many individuals with PKD is that 3 liters is so much water. It's actually not that far off from non-PKD Canadians, where women should be having about 2.7 liters and men 3.7 liters. So many of us just naturally are not drinking enough water. And so when we think about why we need to have the water when we have PKD, is it really helps to lower that vasopressin hormone. And that's why we want to drink enough. And we know that anything less than that 3 liters doesn't really impact that vasopressin hormone. When we also drink that 3 liters, it helps us to manage our urine osmolarity. And so if you do a 24-hour urine collection, we're really aiming for urine osmolarity of less than 280 milliosmoles per kilogram. And basically what that means is we really want to dilute the urine so that the cysts don't form. We also want to reduce the risk of kidney stones, which is a common complication of PKD, and of course, prevent dehydration, because if we're dehydrated, that can harm our kidneys and lower our kidney function. Now, I'd love to know, do you track your fluids already, or do you know kind of just how much you have each day? I have like a little bottle here with me. I know that it's 450 mils, so I know how many of those I have to get through per day. So, perfect. I see some yeses. Yep. I think many of us, that can help keep us on track is having a bottle that we really like and know how many we have to go through, or a particular cup at home. Some individuals I find like to use like a jug of water in the fridge, and they know that if they go through that each day, or tracking your water intake on apps can be really helpful, or even just good old whiteboard and a check mark on the fridge can really help us stay on track as well. And we focus a lot on water, and water being the beverage of choice, because things like juice or pop, they have added sugars in them, and that's not good for our overall health. Coffee and tea are fine to have. We just want to try to limit the total caffeine intake to about 200 milligrams per day, which is usually about 2 cups of coffee or 4 cups of tea. What we've seen in the literature is more than that can increase the risk of cysts from forming. So coffee and tea are definitely the best. Okay, it's just a volume amount. And, it doesn't have to be plain water. It could be like carbonated water from a soda stream, or bubbly, or Perrier, any of those that don't have any added sugars in them. Certainly, I think another big question in terms of fluids is alcohol. So with alcohol, certainly less is more. We want to try to limit it as much as possible. Not only does it dehydrate us, it can also increase our blood pressure, and it can also interact with some medications. So speaking with your healthcare team to really see if alcohol is appropriate for you is important. But really, water is kind of that beverage of choice. And it doesn't have to be plain water either. You can add lemon to it. So right now I have 2 tablespoons of lemon in my 2 cups of water. Not only is this good for flavoring, kind of changes it up throughout the day, but it also gives me citrate. And citrate is helpful for preventing kidney stones. So you could squeeze a lemon, you could do lime, you could do some strawberries and mint. I think in the summertime, we are always looking for different ways of spicing up our water, but really we could do it throughout the year too. So it doesn't just have to be plain water. The next thing we always focus on is salt. And with any kidney condition, we look at salt. And one of the reasons is because high blood pressure is common for individuals with PKD, but also any kidney condition. So with PKD, we're really aiming for less than 2,000 milligrams of salt per day. And We always think of, of course, we can reduce the amount of salt we have in our cooking, but we can really read food labels to see how much salt. And what I like about the food label is this percent daily value. It's actually based off of 2,400 milligrams. So we know with PKD, we want about 2,000. So if we look at the food label and we look at that serving size, we might have more or less than this up here. When we look at the percent daily value for sodium, we ideally want to find foods that are 5% or less. And if we add up all of the foods that we have throughout the day, and ideally we want them to stay below that 100%. Most of us don't have 20 packaged foods per day, so that 5% is really a good target whenever we do have something with a label on it. If you're eating out, I think looking at the restaurant nutrition information is really important. So if a restaurant has more than 20 establishments in Ontario, it will have the nutrition information, including the sodium, on their website. Sometimes I just Google the restaurant name and then nutrition information, and it will come up quite easily. We know that, foods that have a lot of sauces or seasonings or spices on them tend to have higher amounts of sodium in them. So flavoring foods instead with fresh herbs or dried herbs, no salt seasonings or spices can really help to reduce the sodium. And certainly you can use that strategy when eating out or eating at others' homes as well. Trying to choose fresher foods can really help to lower the sodium intake. Oh, we do want to try to limit processed foods and salt alternatives. So for most processed foods, really, that just means reading the food label and being aware of what our sodium budget is for the day. So if we have, 2,000 milligrams of salt per day and we pick up a convenience item, maybe it's a frozen pizza, and we see that half of that pizza has 500 milligrams in it. We know that that can still fit in our day. Maybe we have a salad with it to add a bit of fiber. But processed foods are not an absolute contraindication. We just want to limit them. They can be a really good tool and convenient for many individuals. And depending on our cooking skills, sometimes we might use these. But reading the food label can really help. So while our budget is $2,000 for the day, and ideally we want 5% per item, truthfully, that meal is probably going to be around 25% or 500 milligrams. So we can kind of use the food label to help with that as well. Salt alternatives, though, this is something like new salt or half salt. These products, they actually have potassium chloride in them. So we do want to try to avoid those and instead use those no added salt foods like Mrs. Dash or McCormick's no added salt. And what I like about some of these dried herbs or spices is you could go to like the bulk barn and pick up small portions of some of them to see which ones you like. And being aware of kind of those high sodium sources that we might have in our diet. So different condiments or sauces, canned items, can we choose, a low sodium version or a no added salt version? Frozen meals and deli products tend to be the highest one. And then, when we think about what does this 2,000 milligrams of sodium look like for us? So 1 teaspoon of salt actually has about 2,300 milligrams of salt in it. So it's about, just less than a teaspoon of salt per day. And it doesn't matter if it's Himalayan or pink or black or any of these types of salt. We really want to try to keep it to that 2,000 milligrams. They all kind of have the same amount of salt per portion within 100 milligrams or so. But the difference with iodized salt or table salt is it has iodine in it, whereas pink salt and Himalayan, they don't have that nutrient in them. So 1 teaspoon of salt is 2,300 milligrams. So 2,000 milligrams is kind of the target. So less than a teaspoon of salt per day. Protein, I think, is one of the most interesting areas right now from a PKD perspective, and certainly anything that we look at from a kidney perspective. And with PKD, the type of protein is important. And we really want to be aiming to include more plant-based sources. So these are things like tofu and nuts and seeds and beans and legumes. Quinoa, for example, is a plant-based source. And the reason for that is because they're lower in saturated fat, they're lower in phosphorus and potassium bioavailability, and much higher in fiber. And we'll talk about fiber in just a second. But not only are these easier for the kidneys to filter, they also help to manage the acid-base balance or our metabolic acidosis in our body, but they also keep us full. And they also have benefits in terms of cholesterol. If you are choosing to include animal-based proteins like fish or poultry, try to limit it to just once per day and try to keep the portion size close to that palm. So that's about 3 ounces, and that would have about 21 grams of protein in it. Right now, from a PKD perspective, according to KDIGO, the protein recommendations is about 0.8 to 1 grams per kilogram. So this is different from individuals who have chronic kidney disease. For individuals with PKD, we're really aiming for just what's recommended for the general population. And there's no benefit of a protein restriction, but there is a concern with too much protein. And that's generally over that 1.3 grams per kilogram. And when we calculate how much protein we need when we have PKD, we actually want to be using an adjusted weight because of course we have our kidneys, and when we have PKD, our kidneys can be bigger, and then we also have cysts on them. So your healthcare team will actually take a look at your MRIs and your ultrasounds, and they can actually measure the volume of your kidneys and your liver, and we subtract that to get your PKD kind of weight. And that's the weight we would use to help determine how much protein you need. And certainly your dietitians or your nephrologist can help you with that. When we think about plant-based proteins, I think something I often hear is that I don't know how to use them, or I don't know how to prepare them. And what I love most about them is that they actually just take on the flavor of any of the foods that you're trying. So for example, yesterday, I had a tofu bowl where I made a peanut butter sauce on it with some coconut aminos, and I used a bag of cabbage. And it really just took on kind of the flavor of the peanut sauce. You know, you could use tofu in a stir fry. You could make a quinoa salad with maybe some arugula and tomatoes and mozzarella cheese and some beans, and that would really just take on the flavor of the dressing that you're having. So plant-based proteins are very versatile. Maybe you start with just like Meatless Monday, or maybe you focus on one meal a day that you really want to add and have more plant-based options into. Maybe you put hummus on your sandwich. Maybe you use beans in your tacos as opposed to ground meat. That can really help to improve our kidneys' health as well. Does anyone here already try to incorporate plant-based proteins in their diet? Great. Perfect. Not only are they great for the kidneys, they're great for the environment, they're great for our budgets too, but they have a lot of overall health. Yeah. Yep. Half of your day in plant-based proteins is really good as well too. I think when we start to think about some of the meals that we're having as well, we may already be having plant-based meals and not actually know that we are. So for example, in the morning, if we have oatmeal with some milk and maybe some nuts or something in it, like that's technically a plant-based meal. There's different levels of plant-based eating, right? There's, you know, vegan, which is when we have absolutely no animal products, so no milk, no eggs, no fish, nothing. Then there's vegetarian, where maybe we still include dairy products. And I think from a kidney perspective, those calcium foods help to keep our bones strong. So many individuals choose to continue to incorporate that. Or some just incorporate fish, for example. So there's different types of vegetarian diets, but we use the term plant-based to really encompass just more incorporating more of these plant-based foods, whether that be vegetables and fruit. We're going to talk about that in just a second from fiber, or from these plant-based proteins as well. So fiber. So fiber is actually a type of carbohydrate that we often find in vegetables and fruits and whole grains. And it helps us to manage cholesterol, blood sugars, and our weight. And for individuals with PKD, we want to be aiming for 25 to 38 grams of fiber per day. And one of the ways that we can reach our fiber target is actually by making sure we're getting enough vegetables and fruits. And current recommendations suggest 400 grams of vegetables and fruits or 5 servings per day. And so what's a serving? That might be 1 apple. It might be 1 cup of lettuce. Could be half a cup of cucumber. So that would be 3 servings that we might have per day. We often think of, trying to make sure that half of our plate is in vegetables and fruits. So more vegetables and fruits than the grain products on our plate. And that also helps us to get enough fiber. When we have kidney conditions, we often worry about potassium. And so we should certainly be incorporating these vegetables and fruits into our diet because that helps us to have regular bowel movements. And if we are constipated, our potassium will rise. If we are not able to control our blood sugars, our potassium will also rise. And while diet, if we have a very high potassium diet and we have medications that can increase our potassium, we may need to follow a low potassium diet. But the first thing that we want to be aware of is limiting potassium additives because these have the most bioavailability and less fiber in our diet. And so they can cause higher potassium more than things like vegetables and fruits. So when we absorb the potassium from vegetables and fruits, we actually don't absorb 100% of it. And that's why we want to continue to incorporate some of them into our diet. And if you have a high potassium, of course, your healthcare team can tell you which foods and how much and how often they might want you to have. So for example, something like tomatoes. If we're following a low potassium diet, we could still have, 6 cherry tomatoes on a salad. That would be considered a low potassium food. It's really just about the portion size. And then whole grains. We also don't absorb all of the potassium from whole grains. And again, it helps to manage our cholesterol and our blood sugars and our weight. And those 3 things are really important when we have PKD. So if we choose to incorporate carbohydrates, whole grains, so whole grain breads, whole grain rice, whole grain pastas, as opposed to the refined carbohydrates. So that would be things like white bread or white pasta. I think carbohydrates are one of the most questioned items in the PKD world because we've seen some of those studies of, keto diets in individuals with PKD. Here in Canada, we aren't practicing in that realm. The studies that have come out from PKD patients and keto diets are very small studies. So like 3 months or less than 6 months. And the ones that are longer are not typically on humans. So it's difficult to see what the long-term effect of a keto diet is on for individuals with PKD. And current guidelines from Kedogi is really just to incorporate more of the fiber and more of the whole grains. And it's about the portion size too, right? We can use kind of our hand as a really good marker for carbohydrates. So if we have like a rice or a pasta, right, that's about a cup. That's a pretty good portion there. When we think about fiber and other types of carbohydrates, it's really the refined carbohydrates and added sugars that we want to avoid. And particularly because these can lead to weight gain. And being at a healthy weight is important for PKD. So refined carbohydrates are those things that don't have fiber in them, like white bread or white pasta, juice, soft drinks, baked goods, and candy. They often have really little nutrients in there, right? There's not vitamins, there's no fiber, and they can lead to weight gain or high cholesterol or high blood sugar. And what we know is that these things can lead to faster disease progression with PKD. So we want to make sure that we find a healthy weight for you and we optimize the diet as much as possible. If you are consuming sugars, ideally we want to limit to less than 10% of our total energy, and even better if we can get to 5%. So that would be things like our honey, our maple syrup, sugar that we might get in like a flavored yogurt. All of these things we want to be as little as possible in our diet. I think it's important that we also talk about phosphorus and potassium. And what we've really learned in the most recent years is that they have a very different bioavailability depending on the source. And it's important that we individualize how much we should be having based on our blood work. But one thing that we can all start to avoid is these additives. So here you can see that potassium sorbate is added to this product. And here you can see the phosphoric acid, so where that PHOS is. These types of foods, we would absorb 100% of the potassium and phosphorus in it. And so just by avoiding these, we can already make a big improvement in our food choices and our blood values as well. And on the other side of it, not everyone needs to be avoiding potassium foods. Sometimes we ask people to add these in, and that's really why it's important to understand your blood work numbers and what kind of your healthcare team goals are. So what should I eat? So really the best diet for someone with PKD is one that you can stick to in the long term and really supports a healthy relationship with food. So we live many, many years with PKD, and we want to make sure that what we're doing on a day-to-day basis helps us over many years as well. And also food is something we can control with PKD. So we want to make sure that our relationship with food stays very good. We also want to make sure that our foods that we choose help to maintain good urine osmolarity on that 24-hour urine collection, that it's full of things from fiber, like plant-based proteins, vegetables, and fruits. And really, if we were to take a step back and think about, what does this diet kind of look like? It really looks like a Mediterranean style of eating, right? Lots of those colorful vegetables, giving us lots of different vitamins and minerals. It's also having those whole grains. It incorporates those plant-based proteins and healthy fats like olive oil, and also incorporates physical activity. And so I think that kind of eating pattern and eating philosophy can be really helpful with PKD. But our diet should also prevent complications like high cholesterol, high blood pressure, kidney stones, and also help us to maintain a healthy weight and helps us maintain normal electrolytes like potassium and phosphorus. So your diet or lifestyle choices with PKD might look different than someone else's, and that's why a personalized approach is really important. But if you were to break down some of the things we talked about today, we really want a well-balanced diet. So start to aim for at least 5 servings of vegetables and fruits per day. And this doesn't include the starchy ones like potatoes. Really focus on those plant-based protein sources. So see if you can have, 1 or 2 meals per day that are plant-based. So incorporating those beans and legumes and nuts and seeds and tofu. Focusing on reducing those added sugars and sodium and saturated fats. So choosing like lower fat dairy products by choosing vegetarian proteins or chicken and fish. Those are going to be lower in saturated fats. And how we prepare our foods. So things like olive oil or avocado oil are lower in saturated fat than butter. Consider physical activity and stress management, smoking and alcohol cessation. So those are also important lifestyle things for PKD. And making sure that you're taking into consideration your other needs. So kidney stone prevention, weight management, diabetes, and high cholesterol when you're thinking about putting together a diet for yourself. So on these next couple of slides, I've just summarized kind of what the KDOGI guidelines said, as well as some of the recommendations. So remembering that from water, we want to aim for that 3 liters per day. If your doctor has asked you to have less than that because you have a heart condition or you have edema or swelling on your body, then certainly follow that recommendation. But the goal is to maintain a morning urine osmolarity of less than 280 milliosmoles per kilogram. Ideally aiming for less than 2,000 milligrams of salt per day. And it's not a no salt diet. We do need salt. The lower end of that number is 1,500. If we go less than 1,500, we often can have electrolyte disturbances. And so that 2,000 milligrams is a good sweet spot. And maintain a urine sodium of less than 90 millimoles per 24 hours. For protein, we want to meet the needs of the general population, focus on the plant-based proteins, avoid phosphorus additives, making sure from a fat perspective that we're choosing healthier fats, and ideally less than 30% of our total calories to help with weight management. And saturated fats should be less than 10%. Making sure that we meet our fiber needs of that 25 to 38 grams and follow a low potassium diet if needed. We have lots of time here for some questions too. And I saw there were a few comments coming in. I think I tried to answer most of them already, but happy to answer some questions.